And also anyone who may have had contact either socially or through work with members of that fellowship as a precautionary measure to be tested as well. People should be tested even if they have no symptoms. There is a very good list of the community-based centres where one can be tested in the Auckland region, and of course at your local GP. If you want advice, please do ring Healthline. 4 of the new cases are part of a group of 14 that are associated with a new event. Again, this links back to the Mount Ross School Evangelical Fellowship. This new event is associated with what I would call a series of bereavement activities, including some visits to the household of the bereaved and a funeral on the 2nd of September. Unfortunately, one of the visitors to the household was infectious with COVID-19, and that has resulted in a number of other cases in this smaller subcluster, a total of 14. All the close contacts from those events, including those who attended the funeral, which was 48 people, are now isolating and being tested. So all close contacts are in self-isolation and have been or are being tested. And just a reminder that as part of that self-isolation, the Auckland Regional Public Health Team works with whānau to ensure that their welfare and other needs are met, and also that if they require any security to support their self-isolation, that is also available to make it easier for people. The wider testing we're asking for, again, of those involved in the Mount Ross School Evangelical Fellowship is part of our management of the Auckland outbreak and providing an assurance that it is contained. One of the cases reported yesterday is a student at St Dominic's Catholic College, as was reported last evening, and that student attended school last Friday but left early after starting to feel unwell. The student was tested over the weekend, and any close contacts who are identified are receiving advice on isolating and getting tested. That's close contacts or other contacts from the school. We are also working with the school to arrange testing for the wider school community, staff and students, as part of a precautionary approach. Again, we have done this previously with Mount Albert Grammar School a couple of weeks ago. Further information on where and when testing will be available for that school community will be provided later today by Auckland Regional Public Health. In the meantime, the students and staff are of course asked to not go out and about, to closely monitor their health, and if they have any concerns or develop any symptoms, to please contact Healthline or their GP. Another of the cases reported yesterday, and I should say both these cases are part of this smaller new subcluster, but one of the cases reported yesterday is a driver on the Northern Express bus service. Auckland Regional Public Health will be releasing detailed information this afternoon about the bus routes and the times that this driver was on the bus, but we can say there are no close contacts from the bus trips, which were on Thursday the 3rd and Friday the 4th of September between 5:30am and 1pm and 4pm and 6:15pm. The driver was not symptomatic at that time, wore a mask and gloves while on shift, and there is taping on the bus that creates a gap of at least 1.5 metres between any passengers getting on or off the bus and the driver. However, as part of a precautionary approach, we are working with Auckland Transport to use Hopcard data to identify people who are on or who were travelling on the buses the driver was on, and we will notify them. Passengers do not actually have to self-isolate, but should of course be very aware of symptoms and seek testing if they develop any symptoms. People of course can be tested at their GP or at locations around the Auckland region. There is a list on the Ministry of Health or the Auckland Regional Public Health website. And just while I'm on the topic of GPs, I do want to take the opportunity to thank our more than 5,500 GPs around the country who have worked so hard in our community since the outset of this pandemic right at the end of January. They have been the backbone of our testing program, both in their own surgeries or helping to staff the CBACs right through that period. They have completely changed the way they have had to practice during alert levels 3 and 4, and to keep both themselves and their patients safe. And I want to say they've got through not just the COVID work, but a mountain of other work that they usually have from the care they provide their patients. Hasn't been easy, but I just really want to acknowledge and tautoko their efforts. So overall numbers on contact tracing, since August 11, there have been 3,346 close contacts identified, and 3,305 have been contacted and are self-isolating. And for the most recent complete 7-day period, we have been able to contact 84% of close contacts and have them self-isolated within 48 hours of being notified of a positive result, the benchmark there being 80%. There are now 74 people linked to the Auckland Community Cluster who remain in the Auckland Quarantine Facility, and that includes 58 people who have tested positive, as well as a number of household members. Today there are 4 people in hospital around the country with COVID-19. 2 are stable and in isolation on a ward in North Shore Hospital. 2 are in ICU, 1 at North Shore and 1 at Waikato Hospital. With today's 6 new cases, there are also 4 additional recovered cases, and our total number of active cases is therefore 125. 43 of those are imported cases identified in managed isolation and now in quarantine, while 82 are community cases. And our total number of confirmed cases now is 1,437. Yesterday, our labs processed 8,363 tests, bringing the grand total to date to 831,517. Our contact tracing system, as I've alluded to earlier on, is performing very well, and it has shown us the importance of having a good connected contact tracing system right across the country. When we find someone with a positive test from COVID-19, we need to be able to quickly trace everybody who may have had contact with that person, and this is crucial to stopping further spread. Ultimately, though, our contact tracing system always relies on people, and if you test positive for COVID-19, we need to know not just where you have been, but who you were with and at what times. And on that note, it's encouraging we continue to see the number of people registering with and using the NZ COVID Tracer app continues to increase, and that many people are recording their movements. Of course, the new functionality in the app allows people to put in more detail, even if they sign in electronically with the QR code. You can add detail around who you were with and the times you were there. There are now 2,161,200 registered users. And an average of 2.15 million scans took place each day over the last week. There's another update on the release of the app today, and that will make scanning QR codes even faster and easier. And I'm sure, like me, you appreciated that with the last update, you didn't need to log back in. You remained logged in, and it will update automatically. You will be able to directly open the scan screen if you are logged in, and also bypass the login screen if you don't have time to enter your password and still be able to scan. Diary entries will be stored in the phone now for 60 days instead of 31 before they are deleted. This makes it easier for contact tracers to establish links, possible links between cases that may go back further than the 31 days. That doesn't affect the security at all. We cannot access your digital diary unless you choose to share it after a request from a contact tracer. There is also an NZ COVID Tracer booklet available on the website to help people keep a written record if they prefer to, where they've been and who they've seen if they are not able to use the app. Just a comment now. I'd like to take a moment to provide feedback on the worker at Ridges Hotel in Auckland who was identified as a case, as a maintenance worker there. The investigation on this has now closed and concludes that the most likely source of infection was a one-off exposure event, and that surface transmission in an elevator that the worker used after a returnee from the USA who tested positive for COVID-19 is the most likely route of transmission. Widespread testing around the workers' contacts, including both household and workplace, did not find any other cases of COVID-19. They all tested negative and all had negative serology, which suggests they weren't earlier cases that passed it on to him. And I just want to acknowledge the support that this worker and the staff and management at Ridges have provided for this investigation. It's a complex process and the success relies on engagement and cooperation from the case contacts and their employers. And I do want to thank them again for their support in completing that investigation. That's all I have to say to start with, and I'm open to questions.
Do those in the Mount Roskill subcluster make a deliberate decision not to disclose their close contacts?
So, as we've got more information from Auckland Regional Public Health late this morning, it's clear that the case that is associated with the college in Auckland, the student, and the new cases arising in this around the bereavement event were not previous contacts or close contacts of the Mount Roskill event, and that the reason this new subcluster has arisen is because there was a visit by people who at the time didn't know but who were infectious and visited the household. So as it transpires, with further information from AFS, these weren't people who we would have expected would have been identified as close contacts because there had been no prior close contacts with them prior to the 27th when the exposure took place.
So these people are not part of the church service and the wedding?
Yep, that's right.
The subsequent one?
Yes, they're not members of that wider congregation, but they link back to it because they've been infected by a member of that congregation, clearly unintentionally.
So how was that mini cluster? You've said it's been challenging to deal with. How has it been challenging to deal with?
Do you mean this latest one?
No,
or?
I mean the mini cluster in Mount Roskill.
So the Mount Roskill one, what I would say is that early on, as the public health unit was engaging with that church, there was some reluctance of some of the members of that community to engage and or be tested. That was quickly overcome once we worked with the Māori, or the public health unit worked with the Māori and Pacific teams at the DHB, and actually once there were good networks into or links into the community, there's actually been a high level of testing and support from that church community for the testing and follow-up.
So they are all now cooperating with you?
Well, I don't know the full extent. There were originally 468 people associated with that wider Mount Roskill Evangelical Fellowship, which is quite a large number. And my understanding is that there was a high level of support for and cooperation with the testing.
And how many of those have been contacted? Of the 468?
Well, the contact was made with all of them. Not all have been tested, and there may be reasons for that, including their age. But they were all tested. Many were tested in the first round, and we're just putting the call out for those people part of that fellowship, just to help us get really to really confirm that there's no wider spread, that they all go and be retested.
And just
Sorry, one final.
St Dominic's cluster.
Yes.
How many close contacts have been identified so far?
Sure.
How many are in the community? How many are at the school?
So if I can just call that cluster one associated with a series of bereavement events, and one person from that, of the 14, is a student at St Dominic's. That was the student who was at school until last Friday morning. At this stage, Auckland Regional Public Health is just confirming who all the close contacts are. The message went out to the school last night. However, talking with Auckland Regional Public Health today, we've advised that actually, as we did with Mount Elmer Grammar, that we test all members of that school community, staff and students, because often there could be contact in a corridor, and it's just a precautionary approach we're taking there.
So these 6 people today, they're all previously undisclosed close contacts?
No, these were all people who, actually 2 of them are associated with the Mount Roskill group, but were already in isolation. So they are from families that were already part of that grouping, that sub grouping. The others have tested positive, and they were disclosed as close contacts through this new event that is associated with pre-funeral events and then a funeral.
Is
yes.
one of them a health worker with Hapai Te order?
I don't think that's one of the people today. I think that's one of the cases yesterday who is with Hapai Te order, and so that is one of the workplaces that has been followed up as having potential close contacts.
And did that person visit the Mount Roskill church or have involvement
I couldn't say. I think actually that person. Aside from the two people who were part of the Mount Roskill grouping, who visited the household of the bereaved person, all the others were not associated with the Mount Roskill group, and so they've been infected because they were at the household at the same time, and that involves several other workplaces. I've talked about a bus driver, a school, and of course then there were people at the tangi as well who are close contacts.
How big is the group now associated with the mini cluster, given that it's now, there's this new event and these new bereavement activities and another bus driver? You said originally it was 468, but it must be hundreds more by now, given it's,
in terms of potential contacts, yes. So with this latest events around the bereavement, there are 108 contacts identified there, and of course already in the fellowship, the wider fellowship, which includes sort of 13 smaller groups that get together, there was already quite an extensive number of potential contacts. They're included in that 3,346, which is the number from the start of the Auckland outbreak.
Sure, but I mean, do you know how many of the recently infected people how many of them were not in isolation when they caught it? Can you give any clarity?
No, I don't have any clarity around that.
But that's potentially, they were out in the community for days potentially with COVID-19.
Well, what I would say is that there have been, since we first identified cases within the Mount Roskill Evangelical Fellowship, there have been other cases emerge. They have been, almost all of them have been household contacts, so as we would expect. So the transmission is still happening within families rather than people outside of that in the wider community. This is a sort of another little cluster that has emerged that links back, where someone had gone and visited the household of the bereaved and has infected some other people. So that's led to it's sort of seeded another group of infections. That isn't part of the fellowship, but it does link back to it.
The Health Minister has indicated the police has been brought in to support with the Mount Roskill cluster. What has their role been in this?
So just generally on contact tracing, we do work with the police in a couple of ways already, and I'll talk about what has been added to that. First of all, if we're having trouble getting the contact details from someone, we use the police through our finding services, and we send them the details we have, and they, within a couple of hours, will turn around if they have information about the location of someone. Secondly, if we're having trouble finding someone who we really do want to identify as a close contact and we can't find them, and that's a very small number of people, then often police will support us in going out to find people or support the public health workers. In this instance in Auckland, we've also actually for the last few days had a police liaison person over here looking at our systems we're using here around our contact tracing, just to help us identify what we could learn from the way police do their investigations, not to take control of our investigations. And we've sent that person up to Auckland this morning to go and just work with ARFs to see what other support the police may need to provide around community liaison. So he's up there today. Also, someone from the Regional Public Health Unit has gone up as well to support and see what other relief we might need to provide to the Auckland Regional Public Health Unit, because as you can imagine, the team up there is getting quite tired.
And can you tell me where that funeral was?
No, I don't know where that funeral was.
So
Somewhere in Auckland.
can I just clarify, and I don't know if you may have answered it and may have included it in that long answer, but did police investigate the allegations that the parishioners were meeting despite the self-isolation order, and was there an outcome?
I don't know about an investigation per se, but I do know that there was a meeting held, I think, on the 15th of August, which was after Auckland was in an Alert Level 3 stance, and that I understand that the police were involved in going to ask that meeting to disperse. But I don't believe there was any investigation as such.
Or like enforcement outcome or anything like that?
No, that's not my understanding. You're best to ask Commissioner Costa. But there would have been a number of events during the Alert Level 3 period that the police would, as they do, their first approach is an education and engagement approach. And I understand in that instance that the people at that meeting dispersed.
And can I ask some questions about the false positive case from Christchurch at the weekend?
Yes.
The priest understands that it was a man who came for the mosque terrorist sentencing. We're wondering if you can confirm why and where he was tested in the first place, and how many of his close contacts were notified before he was retested.
I'll tell you what I know. So yes, this was someone who had travelled to New Zealand for the mosque sentencing. He completed 14 days of self-isolation, including around day 3 and around day 12 testing. Both those tests were negative. He then actually had 2 further tests once he left managed isolation. The first was negative. The second, I think it was the second, was a weak positive. The characteristics of that test were suggested an old infection, and we've had a number of these previously. However, it was treated until it was confirmed that it was until it was confirmed it was not an active infection by follow-up tests, which were all negative. It was treated as if it could be a live case, and so his immediate close contacts were also re-isolated with him and tested, and all their tests came back negative, which helped the public health unit draw the conclusion this was indeed an old case and not an acute or an active case.
Why was he tested those 2 further times outside of managed isolation?
It's not immediately clear to me. I think he was under the impression that he should be. He was not symptomatic throughout either his stay, and he didn't have any symptoms and was tested. It may be that he just understood that he needed to have a further test, and he did that.
And it seems like the Ministry of Health may have said that he was in managed isolation when in fact he was in the community and possibly considered positive. Is that the case?
When he received the positive test result, that was indeed from a test done, I think, at a CBAC, and so it was after he had finished his 14 days managed isolation and returned the 2 negative tests. So it was one of those results where, even on the initial result, our strong impression was this was an old infection, but all precautions were taken to identify, isolate close contacts and retest.
But he wasn't shuttled back to the facility?
I would have to check that.
And can you just confirm that, how many days did this all play out?
I'd have to check that as well.
You mentioned
Sorry, I'm going.
This is the first time we've seen, a decent number of cases emerge in a level 2 environment. How are those systems working to ring fence this new subcluster associated with the bereavement event, and how confident are you that you're going to be able to surround that?
Well, the 2 fundamental parts of that will be the testing, and we've clearly got, we know our system's got good capacity to test both the swabbing and then the laboratory processing. So wide testing, wider than we might otherwise do. And interestingly, 2 of our Chief Science Advisor and the Director of Public Health, Caroline Mack, and I talked with their counterparts in New South Wales just in the last day or 2, and this is what they're doing in Sydney, is sort of when these cases do come up, to do very wide testing, including of casual contacts, and we've been doing that and will continue to do that. And secondly, having that contact tracing capacity stood up, and that ability to also bring in the public health unit people from around the country, bring them in virtually, because they can all access the contacts through the National Contact Tracing Solution. So the mainstay will continue to be testing, isolation, support for isolation, including the use of managed isolation facilities, or the quarantine facility in Auckland, and of course the rapid isolation contact tracing.
Outside the context of the subcluster, just with the outbreak overall, have you seen any other jurisdictions using genome sequencing like we're using it, and how much of a game changer has that been?
Well, I can say it's been quite a game changer for us, and again, this is something that came up through the discussion with the New South Wales counterparts as well. They are using the genome sequencing and getting a rapid turnaround, because what it can do is tell you the linkage between cases and also who came before whom, so it helps you understand the chains of transmission. So we're actually working with ESR at the moment too to see to stand up some capacity to do genome sequencing in Auckland, so that we can turn that around even quicker.
The person linked to this new spreader event, the funeral, were they tested prior to going to this funeral? Were they a close contact, a known close contact of people from the wider evangelical church?
So the person didn't go to the funeral, but they visited the home of the bereaved person, and they had been tested because they were a known close contact, but didn't have the test result. when they visited the home, is my understanding.
And in terms of this event that was held during level 3, is there any known spread from the Mount Roskill event that was held, I think you said August 15th?
It's hard to know whether the cases that have arisen, any of the cases that have arisen amongst a group of about 7 families in that Mount Roskill Evangelical Fellowship, whether they were from that August 15 event or from an earlier event. We can't exactly define where the original case came from and therefore where the further spread came from.
And what we're seeing with this new subcluster, the way it's spreading, the way there's these new cases kind of popping out, tentacles going out, I guess, what color is sort of your dashboard flashing right now with these events?
My virtual dashboard, well, it's flashing orange, and it won't flash or go steady green until we're really confident we've got this outbreak, well circled. I should say that this grouping here that's appeared around this bereavement is the only sort of additional sort of tentacle out from the Mount Roskill grouping, and there are no other ones that have emerged either over the last week or so. So it's an orange, it's raising some flags, and that's why we're working really quickly, including that widespread testing in the school, going out onto the bus trips and so on, to make sure we're capturing any possible contacts.
And just one last one. What is the size now of the Mount Roskill subcluster? How many cases are now associated to it?
Look, I'd have to check, but I'm thinking it's just, if you count this additional grouping, which is 14 associated with the bereavement event, my understanding was there were 18, so it's somewhere between 30 and 40, but we can provide that information and follow up.
Is it true that people in the Mount Roskill cluster refuse to go into managed isolation?
Not that I have heard. I know that right since the start of the outbreak, there have been some families who have been, not immediately welcome the idea of going into a quarantine facility, partly because they might be worried about pets. There might be issues around income and so on, but that actually once there's engagement with them, all those matters are worked on with them before they then go into managed isolation or into the quarantine facility. So no one's sort of forced in there, and my understanding is that with that support being provided, that actually people are quite comfortable with going in.
Do you trust people are self-isolating?
Well, I should say that right since the start of this pandemic, there has been always a component that requires a high level of trust. I think the vast majority of people do self-isolate. There's no doubt about that in my mind. There will always be people who won't necessarily comply all the time with those expectations, and our job is to support them to make sure that their welfare and other needs are met, that there's food being delivered, that they've got the support. If there are children, that there are activities that they can do, and if necessary, and we have done this in this particular outbreak, to provide security for them if they want to be sure. Because one of the things that has unfortunately happened is there can be a little bit of negative reaction from the community to these people, and often they're worried about, if they're identified, that they could be verbally or physically abused. So we have offered, and in a couple of cases provided security. Perhaps a couple more, 2 or 3 more questions.
How much of the initial reluctance to get tested was down to people not accepting the science?
Look, I couldn't say exactly. I think there are a number of reasons why people don't like being tested or want to be tested. I guess first of all they have to accept that it is a real thing, and secondly, of course, it is an invasive test, having the swab put up your nose, and some people describe it as uncomfortable. What I can say though is this whole outbreak has shown that if you have good engagement with these communities, actually they come forward and they are very willing to be tested. And we've seen right through that our rates of testing amongst Pacific have been over double those of the general population through this outbreak, particularly in Auckland, Waitemata and counties Manukau DHBs, and likewise Māori rates have been higher than the population average.
I'm confident there's no more reluctance not to be tested.
Well, I think only in this, individuals will have reasons, and for the same reasons that sometimes people do or don't undertake a diagnostic or a treatment procedure. Some people don't get vaccinated when the recommendation is they are vaccinated. So there will always be people will always have a range of views and perspectives, but my clear impression is that this Mount Roskill group has been very supportive, and in particular because there are members of the congregation who are nurses, and they've got involved in actually helping explain and support the testing. One more, Derek, and then I'll continue.
Just that, there's the initial reluctance there and that meeting on August 15th.
Yeah.
Have you ever, in light of those, considered using the Health Act's ability to enforce quarantine on people? And is that something that you are still looking at as a possibility to...
Well, it's absolutely a possibility, and I should say that actually the reason why, the legal basis for people going into the quarantine facility in Auckland is because I have issued a directive under the Health Act. It doesn't, I haven't then had to direct individuals because they have refused, but that is the legal basis that is there. It's not applied as a sort of a strict enforcement requirement, but it just provides the basis for the medical officer of health to request that people go into quarantine. Please.
You've spoken about the invasiveness of the test. Are there other softer options for people who are squeamish about having something shoved down their throat?
Well, there are two ways you can do the nasal swab. The one that's used for children is a slightly less unpleasant one. That's at the back of the nose. The main swab is the one that goes right through into the back of through the nose, the nasopharyngeal swab. So the first of those is apparently a bit less uncomfortable. I actually found out that's the one I had. It still felt uncomfortable enough, I can say. Of course, there's a lot of interest in, and ESR is doing work on sputum testing. The key thing there is to get a really good idea of how accurate it is before we start to use it. I think it will be particularly useful for staff in managed isolation and at the border who have to be tested regularly, like weekly. I think it will be much more pleasant for them. So we're very keen to see if we can make that testing available as a screening test sooner rather than later. But it's not imminent. It's not in the next few weeks.
You mentioned GPs earlier and the work they're doing. Has the ministry's communication with GPs been outstanding in your mind, or is there work to do to improve the information flow to doctors?
It's a bit of a setup, that question. There's always work to do, and some people might describe it as outstanding. There will be others who will say there's a lot of work to do. Look, we're continuing to work really closely, and I was just talking this morning with the head of General Practice New Zealand. Actually got a very nice letter from him and the Clinical Director of General Practice New Zealand yesterday, thanking the Ministry for the work and our ongoing commitment to working closely with them, so we'll keep doing that. Final question?
There's now been some 26 positive cases in managed isolation and quarantine from India. Is there any consideration being given to restricting the flow of people from India to New Zealand because of this high proportion of positive cases?
No, there hasn't been, and that's not something that would specifically be looked into. This purely represents the fact that there is a very high and increasing rate of infection in India, and you will be reading about that. Remember that every person off every flight is treated as if they could be carrying COVID-19, and hence the infection prevention control precautions and the regular testing. But obviously, with that higher rate of infection coming off those flights from India, there's particular caution and precaution being taken with people on those flights.
Could I ask you one quick more question? Serological testing. Could you just restate the Ministry's current position on that?
So serological testing we are using and have used as part of this Auckland outbreak, in particular to help us understand whether there are people in households or in workplaces who may have been infected earlier, are not acutely infectious, but may have preceded the case that we have found. So, for example, I mentioned earlier, we did serological testing on a number of the co-workers of the person at the Ridges Hotel, as part of trying to find out whether he may have been infected, for example, through one of the nurses or one of the other people that work there. All of that serological testing was negative. And likewise, early on, we had a large household where we were surprised only one of the people in that household tested positive. So we did some serological testing to find out if there may have been earlier infection amongst members of that household, particularly children who may have been asymptomatic, and that testing was also negative.
These bereavement bereavement events, they're recent, aren't they, these cases, and how long, I mean, that could potentially push the tail out of this outbreak?
It indeed could push the tail of the outbreak out. Well, it could, but again, the key thing here is that that any additional cases occur amongst people who are known close contacts already in isolation and have been tested as such, rather than popping up elsewhere in the community. Thanks very much. I appreciate you coming along today.